Good morning. I'm Laura Leninger, a communications specialist with the SEIB. I welcome you to the 2021 Payroll and Personnel Conference. I will go over a few housekeeping items in today's agenda. Let's get started. Questions during the presentation. All attendees are muted during this presentation. However, you may use the chat feature. The presentation is being recorded and will be posted online for future reference. Please send general questions to info@alceb.org and specific questions to your designated benefits advisor. Here's our conference agenda. Note that we will take a break after the SEEB plan options.
Welcome to the 2021 Payroll and Personnel Officer Conference. We hope that you'll find the information covered in our presentation to be helpful as you help your employees. Much of this information will feel like a review. However, we have included several updates to forms and procedures over this last year. We'll start off this year's conference with a frequently asked questions section that details information often overlooked or processed in such a way that it can cause delays or even cancel an employee's health insurance coverage. Also, please be sure to complete the survey that will be available at the end of our conference. The surveys will be emailed to each registered participant, and we look forward to hearing from you. We hope the information you're about to see will be helpful to your agency. Thank you for attending.
We have a video from our enrollments department. Please enjoy.
Hi, I'm Patricia Driver with the State Enrollments Department. I'm the Assistant Program Manager, and I'm glad to be able to speak on here today. And I wanted to let you know right up front that we appreciate and thank all of our payroll and personnel officers because we appreciate you helping the new employees and the people coming in, and we thank you for sending us what we request and what we need from y'all, and that's very much appreciated. And today I'm going to speak on enrollments, what forms to use, when to use them. So the very first form I want to talk about is the IB02 new enrollment form, and that is for a new employee. When a new employee comes in, that's what you would have them to complete if they're eligible for our coverage with the State Employees Insurance Board. And agencies, payroll and personnel, you have to determine when a member is eligible for our coverage because that would be the way you'll know what form to complete. As a new employee, when they fill out the form, just make sure the forms are legible and that every block is filled in because a lot of times we do get those forms where they're missing either a birth date or a social or something like that. So then we have to bug y'all because we may call the employee, but we have to have everything completed, every section, and then it has to be completed at the bottom of the enrollment form by the employer, the payroll and personnel, and also signed by the employee. Just make sure that everything is signed and completed and legible because sometimes we do have a hard time reading some of them. Also, you can use that same enrollment form for if somebody is on regular leave without pay and they've left and did not keep our coverage. You can use that same form to return them back to work. That form can also be used for retirees working. If they come back to work as a retiree, you can use the IB02 if they're working 30 hours or more. That's just, because the agencies, you can mark on there what status they're in. If they're 3/4 time, you can use that form for a retiree working, and we will put them in the system as a 3/4 time employee. You will also need to make sure that you set up your portion of the Health R screen, and then we set up the Health C screen for a new employee. So that is the Health R is for us to get the $930 from the agency share that you pay us. And then it's also the same thing, the IB02 that I was talking about, you can use for the rehire retirees. If they're working 30 hours or more, they would also be set up for y'all to pay us the $930. And they also get an active rate for just like if they were an active employee. So that IB02 can be used for active employees, new employees, returning from military leave without pay or returning from regular leave without pay. So that form is used several times, but mainly it's the most important is for a new hire. But also we have a new form this year. It's an IB-35. If you hire someone that's like a temporary employee, or they're contract workers, they're not eligible for our coverage, you would have them to complete the IB-35. And the reason behind that is because we now, and we have been having to report to a reporting system that reports to the IRS. We have to report every employee that's working with each agency. So some of them are not eligible for our coverage, and at that point that's where you can fill out the IB-35 or have them to fill out the IB-35 for them to complete to get in our system so that we can report. And this is all went into place when the ACA guidelines went into place. And so we just have to report to this reporting system so that we don't get penalized and your agency doesn't get penalized for not reporting an employee that's working. Also, we have an IB-17 enrollment form. It's a rehire retiree enrollment form. When a retiree has retired and they come back to work as a retiree working, and if they're working 10 to 29 hours per week on an average, they will complete the IB-17 form. That form, we hold that form in enrollments. We hold it for 6 pay periods. And then we claim that retiree working as a retiree working in our system. So the way, you would have to determine the hours. We do not do that. And so once you've determined that and sent that form to us, we are going to hold it for 6 pay periods before we claim that retiree working. If they're working less than 10 hours, we do not need anything from your agency. Same thing with if you hire an employee, a new employee, if they're not a retiree working, if they're just a new employee and for some odd reason they're just going to work less than 10 hours. We would not need any information from your agency on either one of those people, the retirees working or an active employee, if they're working less than 10 hours. Also on the IB-17, you don't have to worry about, when we get those retiree working forms, we will determine if they're Medicare eligible or not, and then we claim them in our system of which category they need to be in. So just the main thing, just get us that form and we will, handle it once we get it into the enrollment section. Also, we have another form this year that's new. It's an IB-04 retiree enrollment form. If you're a retiree fixing to retire, you'll do all your paperwork with the retirement system to set yourself up as a retiree with them. And then you can go on our website at www.alseib.org. And this is where you can get all of our forms, but this will be where you find the IB-04 as a retiree. You can fill this form out. This is to let us know you want to keep our coverage. And also it will, if you want to make changes, you can now make changes at time of retirement. So if you have a change you want to make that's different from what you've had in the system in the past, you can do that as a retiree. Also, if you have been gone from the state service and you're no longer in our system, you resigned, you quit state service, and then you decide it's becoming, you're eligible now to retire because you left your money into the retirement system and now you're eligible to retire, you would also fill out this form, the IB-04. Also, you still have to go through the retirement system because the retirement system sends us a Form 12 to let us know that you are eligible to retire. And then we also would need the IB-04 from you to set you up with any changes you may have, or like if you have a different address than you had before, to update changes. That's what that form is for. And so just remember, if you ever have any questions, let us know. My motto is, if you have a doubt, find out. Thank you.
Hey y'all, I'm Jeannie Blake, Benefits Advisor for the State Employees Insurance Board, and today I just want to give y'all a little reminder about our flex benefits. If you enroll in the Dependent Care Reimbursement Account, otherwise known as the DCRA, Just remember that this account will only reimburse you for child care and elder care expenses. It will not reimburse you for school supplies, school clothes, or food. The DCRA account is also not going to reimburse you for health care expenses of your spouse or dependent children. Thank you.
Hello, my name is Asia Harrison, and I'm with the State Employees Insurance Board. I'm a health insurance specialist with the Enrollments Division, and I'm here to talk about state personnel's Form 11 and why it's important for the State Employees Insurance Board to get a copy of the Form 11 for your employees. It's important for the agency to send us a copy of the Form 11 for us to determine whether the employee is separating and needs a COBRA packet, or if the employee is transferring and we need to notate that the employee is transferring. The Form 11 is good to send from the gaining agency as well as the losing agency, just in case we don't receive a copy of the Form 11. The SCIB asks for a copy of the Form 11 when your employee is going on leave without pay, whether it's military leave without pay, regular leave without pay, or FMLA leave without pay. It's important to indicate on the form next to the leave without pay whether the employee is on FMLA or non-FMLA. We also ask that you do send us a copy of the Form 11 when the employee returns from their leave without pay. If the employee continued to pay the premium during the time that they were on leave without pay, we ask that you send us a copy of that Form 11 only. However, if the employee did not pay their premium, we would need a copy of the returning Form 11 as well as an IBO2. Remember, when in doubt, just send an IBO2 if you don't know whether your employee paid or did not pay while on leave without pay.
Proof of loss of coverage is required along with the IBO3 membership status change form within 30 days of the loss. Proof of loss should list the reason, the date, and the type of coverage lost for all individuals affected. Oftentimes, what's missing is the reason why the coverage ended. Members can send in a COBRA document or a letter of separation as long as it lists the type of insurance and the date the insurance was lost. The end.
Hi, I'm Mary Catherine Carlisle, Communications Specialist for the SEIB. We hope you have enjoyed this Enrollments Frequently Asked Questions video, and we also hope that you enjoy the rest of this presentation. Thank you so much for watching.
Now we will discuss our changes for 2022. Premium and benefit changes for 2022. There will be no premium, deductible, or copay changes for active employees. New enrollees will have a grace period for all discounts, and waivers are 60 days from enrollment date. At this time, we are allowing 90 days for wellness. There are new plans for employees and retirees: a limited purpose HRA, a retiree-only HRA, and a TRICARE supplement. New for retirees. All retirees must fill out a retiree enrollment form, an IBO4. New pre-retirement info sheet. You can visit our website at www.alceb.org/retiree. The maximum contribution amounts. The healthcare reimbursement account has a $2,750 maximum contribution amount. There is talk of this changing, so check back on our website for more information. The dependent care reimbursement account has a $5,000 maximum. In the event that IRS increases the maximum contribution amount before the beginning of the plan year, members choosing the maximum HCRA annual contribution can elect to increase their annual contribution by indicating that on their enrollment form. HCRA has an expanded list of eligible expenses. View at www.optum.com/financial. Your carryover of all unused 2021 funds for both HCRA and DCRA will be allowed for the 2022 plan year. Members with HCRA funds must re-enroll to take advantage of this benefit. Unspent DCRA funds will automatically carry over. Rollover amount for HCRA will be limited by the IRS in 2023. DCRA has no rollover provision. Unspent funds will be lost at the end of 2022. We now have a discount verification system. The local number is 334-263-8454 or toll free at 841-9489. You can check the status of your wellness or your gap in care premium discount. You can also check the status for subscribers or covered spouses. This is a free service available 24/7, 365. We have text reminders coming soon. If you'll sign in to your MySeeb account and go under Communication Preferences to enroll, you will start receiving texts as soon as the service is live. We have a new employee online enrollment coming soon as well. All plan books will be online. The administrative guide is also online. The benefit guide for new and active employees will also be on our website.
Good morning, guys. My name is Rick Wages. I'm the Benefits Advisor for Central Alabama. We're going over some SEIB health coverage today. If anyone has any questions, please feel free to submit them as we go, or you can call us afterwards if you don't feel comfortable submitting it online. All right, SEIB health coverage options. State Employees Health Insurance Plan is the one that we actually pay premiums on. It's medical administered by Blue Cross Blue Shield of the state of Alabama. Our pharmacy on that is administered by Optum RX. Then there's a supplemental plan, which is also administered by Blue Cross Blue Shield. We have a premium cash option plan, which is administered by Optum Financial, formerly known as CYC. We have a limited purpose HRA administered by Optum Financial, also formerly CYC. Our optional plan is administered by Southland Benefit Solution. We've added a couple of new plans in here this year. Members are eligible to enroll in only one option on these plans. All right, next slide. State Employees Health Insurance Plan. This tells you a little bit about it. Medical coverage with prescription benefits. There's monthly premiums, co-pays, co-insurances, and deductibles, plus a spousal surcharge for those with an eligible covered spouse, gaps in care premiums if identified, and a wellness premium if applicable, and a tobacco premium if applicable. There are discounts and waivers available. For more details on this, you can visit our website at www.alseib.org. Let's talk a little bit about the discounts and waivers that applies to our medical coverage. Okay, guys, this is a non-tobacco user discount. It is Form IB05 on our website. In order to get this discount, you must be tobacco-free for 12 consecutive months. The discount is $60 per month per member and spouse. Members can also apply for this discount by logging into their account on the myseib.org website. All right, the wellness premium discount. This is the form that you print off of our website to take to your doctor. It's a Form IB13 on our website, which is www.alseib.org. You have to have your wellness screening completed by October 31st, or have a follow-up visit if you're given a referral to your physician by October 31st. This is a $25 per month discount for you and your spouse if your spouse is on our account. There's a gap in care premium discount. This is not a form that you need to fill out. This discount is claims based. You have to close identified gaps in care. You can log on to My Blue Cross at www.bcbsal.org and look for your care reminders. It is a $25 per month discount for member and spouse if you have a spouse on your account. Also, you're sent 3 reminders through the mail, at least 3 reminders through the mail. The first one usually comes out around the first of the year, the second one about the middle of summer, sometime around May or June, and then the third one comes to you in the month of September sometime. Please be looking forward to them. They identify what gaps you need to close or what procedures you need to have done in order to keep receiving this discount. Okay, this is a spousal surcharge waiver form. That form is a Form IB25 on our website. There are 4 reasons that your spouse can be on your insurance and you not pay this surcharge. One is that he is not eligible for other group health insurance through an employer. The other one is that the employer's health insurance for the premium exceeds $255 for the lowest single plan available to him. The third one is that he's employed, retired, disabled, or self-employed. And the last one is that he's a current new hire to a program where he cannot get on his insurance until open enrollment, which will be a portion of the year. This is he or she cannot. This is a $50 per month discount. All right, the next form is a federal FPL, Federal Poverty Level Premium Discount Form. It's a one-page form. It's very simple. It gives you a discount between 10 and 50% of the SEHIP monthly premium. These forms is an IRS program that's based on total household income and size reported on your federal income tax return. Application and federal income tax transcript must be submitted directly to the SEIB accounting. If you'll look in the middle of this form in blue writing, there's a website. That's where you can go on the IRS site and request a tax transcript. All right, discounts and waivers. All discounts and waivers are prospective and can be earned the first day of the second month after SEIB receives the missing information if you missed your deadline. Remember, most of the deadlines for us are October 31st. Refunds are not given for failure to timely submit appropriate information by the deadline. You can visit our website, www.alseib.org, and create your own MySEIB account. That gives you the ability to verify your discount, or you can call online, or you can call the SEIB at 866-836-9737. There's also a verification line for wellness and gap in care premium discounts. That line is a local number, 334-263-8454, or toll free at 866-841-9489. Here's a SEHIP premium slide. It shows the monthly premiums of our health insurance. Single is $140 a month. Family without spouse is $330. Family with spouse is $490. All of these are prior to any discounts. If you go down the slide, you can follow the discounts. An example from the single was that there's a non-tobacco user discount of $60. There's a wellness premium discount of $25, and there's a gap in care discount of $25. What that means is that a single person who gets every discount will end up paying $30 a month for their medical insurance. If it works the same way on family with spouse, the total premium is $490. If both the employee and spouse does not use tobacco, that's a $120 discount. There's a wellness discount of $25 each. That's a $50 discount. There's a gap in care discount of $25 each. That's a $50 monthly discount. And then the spousal surcharge waiver, is $50. That makes the total amount of premiums for medical coverage if you're family with a spouse and you get all discounts, $220 a month. All right, next we're going to talk about some standalone policies that's offered to state employees. Okay, we're looking at standalone dental plans. State employees are given two options: Blue Cross Blue Shield, which is a traditional dental plan, and Southland, which is a non-traditional dental plan. Blue Cross Blue Shield pays in 3 service categories. Cleaning is covered 100%, once every 6 months or twice per year. Basic and major services are covered at 50%. Southland, cleanings are covered at 100%, once every 6 months or twice per year. But theirs is a little bit different. They divide theirs up between individual and family. On an individual, Southland covers basic and major services at 80%. On family coverage, Southland covers basic and major services at 60%. One caveat in these things is there is no orthodontic services in Southland. Blue Cross Blue Shield does have orthodontic services. They're covered at a rate of 50% with a maximum of $1,000 lifetime for dependent children under the age of 19. Other standalone policies that might interest our employees. There's a Southland cancer policy. Some of the highlights of it is there's no pre-existing condition limitation. What that means is that you don't have to wait a certain amount of years after having cancer before you can apply for this plan and get covered. It's the only one I know of in the industry. It pays regardless of other coverage. In other words, it lays on top of your medical plan. The cost of it is $12 per month for single, $24 per month for family. The other policy we have to talk about is Southland Vision policy. It provides either contacts or lenses and frames, but not both in any plan year. The benefit for refractive surgery is $150 per eye. It's $12 a month for single coverage, $24 a month for family coverage. Either of these two policies can be signed up for at any time during the year and will be effective the first day of the following month. Okay, we're talking about other standalone policies. This one is new for us this year. This is a Selman TRICARE supplement, which is basically a supplement that is to TRICARE what our Blue Cross Blue Shield supplemental is to our Blue Cross plan. It has voluntary insurance designed to supplement TRICARE to help with out-of-pocket healthcare expenses. It works best with TRICARE Prime, Select, and Retired Reserve. Military personnel who have TRICARE that are not active duty, not eligible for Medicare, and under age 65. The premiums for this plan are $60.50 for single, $119.50 for children only or spouse only, and $160.50 for family coverage, which means spouse and children. The policy can be signed up for at any time of the year and will be effective the first day of the following month. Here are the free benefit options. There are options that are available to members with other group health insurance, and I have to emphasize all on there because the two requirements, the one real requirement to getting these policies is that you have to have other group health insurance somewhere else besides the state of Alabama. The other group health insurance can be offered to a spouse, a parent, if the employee is under age 26, or another employer. Members of the SEIB can only enroll in one of these healthcare coverage options, regardless of subscriber or dependent status. All right, the supplemental plan. Our Blue Cross Blue Shield supplemental plan eliminates most copays, co-insurance, and deductibles when your primary coverage does not pay 100%. In other words, what that means is when you go to the doctor and there's a $20 copay with your primary insurance, this is going to pay that. Primary insurance deductible cannot exceed $1,400 for single or $2,800 for family coverage. The plans are free for single or family coverage. It excludes government plans such as Medicare, PHIP, TRICARE, TRICARE for Life, Medicaid, etc. All right, next we're going to talk about the premium cash option. The premium cash option allows the SEIB to reimburse up to $175 per month tax-free based on the primary coverage premium. This reimbursement can be mailed directly to the member or direct deposited into a checking or savings account. Your account can be viewed and claims made by using the Optum Financial, formerly known as CYC, mobile app or on the www.optum.com/financial website. The mobile app that goes on your smartphone works really well with this, I'm told. I've never had the ability to use this plan myself. All right, the next thing which is new this year is a limited purpose HRA, and it's eligible for those with other group or non-group health insurance coverage. It reimburses up to $175 per month tax-free for use toward eligible dental and vision expenses. The reimbursement can be mailed directly to the member or direct deposited into a savings or checking account. Your account can be viewed and claims can be made using the Optum Financial, again formerly known as CYC, mobile app or on the Optum.com financial website. The optional plan provides 4 benefits in one. There's a dental benefit, a vision benefit, a cancer benefit, and a hospital indemnity benefit. It coordinates with other dental and vision coverage. cancer and hospital indemnity pay regardless of other coverage, and they pay directly to the SEIB member. There's a 12-month minimum enrollment period for this plan. If you were to opt for this plan and your spouse loses their coverage, the same requirements apply to someone who's lost their coverage. There's a 30-day time period that allows you to come back, special enrollment that allows you to come back to us for primary coverage.
We'll now have a 10-minute break. Welcome back. Next, I would like to introduce Lisa Reeves with the Wellness Program, and she'll explain a little bit more about Achieve Wellness.
My name is Lisa Reeves, and I am the Nurse Administrator for the State Employees Insurance Board. Today, I want to share some of the highlights of the Achieve Wellness Program. You can access this information at www.alseib.org/wellness. The Achieve Wellness Program is a voluntary program designed to help members and covered spouses increase awareness of their physical condition with the goal of preventing, delaying, and managing, or even reversing chronic diseases. This benefit is at no cost to you as a valued member. There are premium discounts available for participating members. Again, look at our information on our website at www.alseib.org/wellness. So how do we achieve wellness? We have broken this process down into 3 categories. The first is to assess. This means to check or determine. During your wellness screening, we screen for risk factors. The second process is to avert. This means to avoid or detour. We do this through our preventive exams, or what you would call closing your gaps in care. The third is to advocate, and that means to encourage and promote. By doing this, we offer free programs and resources to our members. When we assess, we look at your wellness screenings. We do this by looking at your blood pressure, your cholesterol, your glucose, and your BMI numbers. If determined at risk, the member will receive a physician referral for follow-up. The screening is not complete until there has been a follow-up on the risk factor. Remember, this risk factor follow-up is due by October 31st as well. Here are some details regarding your wellness discount. Who is eligible to participate? All active employees, non-Medicare retirees, and their covered spouses who are on Group 13,000. Who is not eligible? Medicare-eligible retirees and their Medicare-eligible covered spouses, dependent children, and members enrolled in any SEIB plan other than Group 13,000. What exactly is required for an annual wellness screening? It is required by October 31st of every year. If risk factors are identified, follow-up is required to complete this activity. It is also required to be completed by October 31st. Where exactly can you get screened? You can get screened at your work site, county health departments, the state wellness center, pharmacies that we have listed on our website that are participating in our program, and your healthcare provider. Just remember that if you do see your healthcare provider, you will be required to pay the copay and provide the provider with the form for the information. You will receive a $25 monthly premium discount once you complete the wellness screening and referral, if applicable. To find out if you have had your wellness screening and if your discount has been applied, we now have a discount verification line in place. That telephone number is 334-263-8454. The next is to avert. This means providing preventive screenings. You may have heard this before when we talked about our gaps in care. The Gaps in Care program is designed to identify certain national standards of care that should be completed in order to support your overall health. Examples of these are breast cancer screening, cervical cancer screening, and colon cancer screening. And if you're a diabetic, then a hemoglobin A1C test and an eye exam. You must close the gap by October 31st of the year to avoid a $25 monthly premium. Blue Cross Blue Shield will be sending a letter in February of each year for those who will be required to close their gap. You can also call our discount verification line at 334-263-8454. The last is to advocate. This means to provide free resources and programs to our members. A list of our wellness programs are Verta Health, Wonder Health, My Blue Health, discounts at select exercise facilities, physician-supervised weight loss programs, nutritional counseling programs, the tobacco cessation program, and the Baby Yourself maternity program. You can find more about these programs at our website at www.alseib.org/wellness. The first program I'd like to discuss is Verta Health. Verta Health is a program that has been designed to help members with type 2 diabetes lower their blood sugar, their A1C, and weight with decreased risk and limited cost. There is no cost to the member to become a member of Verta. The requirements are that you are a type 2 diabetic and Verta approves you as a participating member. They provide 24-hour counseling, remote monitoring with free supplies, and physician consults with you and your MD. Now listen to one of our members as she discusses her experience with Verta.
15% of Alabamians suffer from type 2 diabetes. That's why one Montgomery resident is changing her faith and working to make a difference. Joining me now via Zoom is Alma Addy with her story. And when did you first find out you had diabetes?
The first time I found out, I was going through my pregnancy with my first child, and I had gestational diabetes.
And you were put on insulin, you said about 25 years ago, but your blood sugar was still out of control. What did you do next?
Well, we, of course, the doctors and I considered more medication, but it was still not coming under control. So I started changing the way I eat and becoming more proactive with exercise and just motivating myself to want to do better and to do better.
How difficult was that for you, and what do you hope to say to other people who are trying to take control of their health?
Well, it is a difficult journey. You have to maintain your own motivation, your own encouragement. Please follow up with your doctors and keep your appointments. Make sure that you are doing your regular testing. And above all things, ask questions about different medications that they're asking you to do. Make those lifestyle changes where you're becoming more active, where you're making great choices and more healthier choices about your foods. One of the things that most people get discouraged because they're having to stick their fingers, do a lot of the testing, but that is the only way you're going to know how well you're progressing. And even if you fail or fall off the wagon, don't get discouraged. Continue with the process because you will see the results in the end.
Tell us about the Verta Health program.
Verta Health has been a lifesaver since the state of Alabama State Employees Insurance Board instituted the programs. They have actually been able to help me reverse my type 2 diabetes. When I started with them, my A1C was 7.4. It is now 5.4. I no longer take diabetic medication. I'm aware of what foods I can and cannot have, and how it affects my actual blood sugar. So it has been a godsend to me, and as well as to my family, because I still encourage them to follow along with me on this journey as far as the types of foods and what we eat and our choices to stay active.
What advice do you have for people who are recently diagnosed and they're just discouraged?
First of all, please don't be discouraged. It's a part of life. And what you do is make the determination that you're going to finish strong. Always follow the doctor's instructions. Above all things, ask questions, because that is what's going to help you to understand what it is that your body's going through. Please know your family history, because with your family history, you can determine how far back this situation has gone. But don't be discouraged. Don't be afraid. Just stay positive. You have to encourage yourself.
You said you're not on a lot of the medications you were before. How are you feeling overall today?
I feel wonderful. I've come off of all of my diabetic medication. I'm only down to one high blood pressure pill and one cholesterol tablet that I take, and I'm exercising. I can do stairs now. I walk every day. That is the staple for my exercise program is walking. But I also do walk videos, some Zumba, and I feel great. I have a lot of energy.
Thank you so much for sharing your story here with us on Alabama Live.
Oh, it's my pleasure. Thank you for having me.
Thank you.
The next program is Wonder Health. This is a weight management program for our members on Group 13,000 for subscribers and their spouses. The only requirement is that your BMI is 26 or greater. There are no restrictive diets, calorie counting, or specialty foods required in this program. Remember, this is a free program. It lasts for a full year, and it involves videos and emails with member participation. You will learn how to change when and how you eat, and participants who remained in the Wonder program for 10 weeks lost an average of 10 pounds. Next, you will.
Hi there, I'm Todd. I'm the Chief Inspiration Officer for Wonder Health. We're honored to be working with the Alabama State Employees Insurance Board, and I'm delighted to tell you a little bit about our program. You know, when you ask, most people will tell you that they'd like to have better health, but especially in today's environment, that can be pretty complicated and confusing. We're surrounded by all sorts of programs that often overpromise and underdeliver. And there's a reason that the odds may seem stacked against you. They kind of are, which makes it tough for you to find a program that will actually work. Well, guess what? I'm pretty confident you found one.
Welcome to Wonder, a world where weight loss is a science, not a diet. Where you don't have to live on kale salads or hit the gym every day. No points, plans, or counting calories. You'll have the freedom to eat your favorite foods. You'll lose weight, sleep better, stress less, and more. From our welcome kit to 24/7 support, our online community, and our 100% digital program, you'll learn clinically proven skills that retrain your brain. Our weekly on-demand masterclasses are an eye-opening perspective on better health. You'll learn things like the science of eating pizza or the best time to eat for weight loss, all taught by our renowned team of doctors and clinicians. And whether you love burgers or sushi, no matter what your background is or where you are on your journey to better health, Wonder can work for everyone.
It just clicked, and it started to say to me that, you know what, eating isn't the biggest part of it. It's why we eat, how we eat, and it just all came together for me.
It didn't tell me, oh, you can't have this or you can't have that. It's all about what I can do.
Wonder gave me the roadmap to follow, and so once I made the connection, I was like, oh.
So, how does Wonder work? Once accepted, we'll deliver a welcome kit right to your home. You'll then access your personalized digital platform through your desktop or phone, whenever it's convenient for you, 24/7. Through fast-paced weekly video lessons, you'll learn principles that address all aspects of eating, including the when, what, how, and maybe most importantly, the why.
Your Wonder skills will help you make the connection between your thoughts and your feelings and your food choices, and figure out healthy alternative responses to feelings.
But I have news for you. The clock should not tell you when to eat. Your body should. So to lose weight, we need to make a habit out of listening to our body and only eating when we're truly hungry.
You can also expect to learn new skills and clinically proven strategies regarding sleep, physical activity, and how to improve your overall health.
Do not think of the scale as a judgment every morning. It's rather a tool focused on accountability that helps you make better choices through the day around food and physical activity.
Next, let's do an energizer to get the blood flowing by moving our arms and legs with what we like to call a standing mountain climber.
We're trying to minimize the blue light because that blue light actually tells our brains it's daytime. We don't want that. For at least an hour, you want to step away from those lights before you go to bed.
Wonder allows you to lose weight and still enjoy your favorite foods, although we will give you tips on how to enhance the flavors of whatever cuisine works best for you.
When we talk about throwing in herbs, that's the way to finish a dish with floral flavor or aromatics. It gives both taste and aroma to the dish.
Your Wonder journey includes 3 stages: Wonder Skills, which is all about skill building, followed by Wonder Up, more personalized lessons for skill reinforcement, and Wonder Last, to help you maintain your skills to bring lifelong lasting change. Our participants also have access to our Wonder Health Coaches, our online community known as WonderLink, daily nudges, as well as 24/7 on-demand resources. Now you're most likely asking, and rightly so, does this work? Especially now. We've all heard of the quarantine 15 or the COVID curves. But while much of the country has been gaining weight during these stressful times, Wonder participants have actually lost weight, an average of at least 8 pounds for both men and women. And maybe of even greater importance, Wonder participants have improved their quality of life. Over 60% have gained confidence, 63% report more energy, 59% improved their mood, a third of folks are sleeping better, and 68% are now more physically active. Simply put, Wonder participants lose weight and feel better about themselves and their future.
I feel amazing. My confidence level boosted up a whole lot. My mental health increased greatly. It was a light. It was a light for me.
Once I started practicing it, it was like the small wins along the way that really build you to feel awesome.
I can do things that I couldn't do. I can do my job better than I did. When that happened, I was sold. Let's go.
I realize now that it's actually in my hands. Like, I have the skills to make this change when I'm ready for it.
It's just been a freedom that I've never experienced before, with not having to think and be obsessed about food, and just to enjoy life and to enjoy all of the benefits that I've gotten by getting healthier.
It's time for a weight loss program that not only works, but goes way beyond the number on the scale. Expect to run after your kids without running out of breath. Expect to live your why. Expect to have more pep in your step. Expect to be supported like no other. And expect results that actually last. Wonder. Expect it. Wonder Health is offered at no charge to all subscribers and spouses enrolled in the State Employees Health Insurance Plan, administered by Blue Cross Blue Shield of Alabama. To sign up or learn more, simply visit wonderhealth.com/SEHIP.
The last program that I want to bring to your attention is My Blue Health. This is provided by Blue Cross Blue Shield. This provides you a personal care team for chronic conditions such as asthma, coronary artery disease, COPD, diabetes and prediabetes, and heart failure. They will be able to locate a doctor or specialist, schedule appointments for you, explain your benefits, address your questions and problems, and research issues concerning your health needs. All of this is free to the member. This includes the subscriber and the subscriber's spouse who are on group 13,000.
Good morning. My name is Michelle Dallas. I am the Benefits Advisor for Southwest Alabama. Today I will be speaking to you regarding Teladoc. Teladoc. Teladoc, you have free access to a physician 24/7, 365 days a year by phone and mobile app. When to use Teladoc? Well, your primary care physician or child's pediatrician is unavailable. I know for me, my kids get sick on Friday evening and Sunday evening when the pediatrician is gone. This is a great tool to use. Teladoc has become my friend. You can schedule when your schedule just doesn't permit for an appointment, you're out of town for a business trip or a vacation. I know I travel a lot, and if you start to not feel well, hey, you can use this Teladoc app so that you can get an appointment with a doctor and you can get some medication ordered. Or you live in a rural area where you have limited access to care, or you just need a refill of maintenance medication. Remember, Teladoc is not a service for emergency care. How does Teladoc work? 1, you must register. 2, you must request your appointment. 3, you have a visit with the physician. 4, your issue is resolved. Some of the conditions that Teladoc treats. Our top diagnoses are nasal congestion, allergies, cold and flu, cough, skin issues, sinus problems, pink eye, bronchitis, upper respiratory infection. Now, prescriptions may be provided when needed. Teladoc will not prescribe any type of pain medication through this service. If you are experiencing chest pains or by chance you have cut your finger really deep, just know this is an emergency situation and you will need to visit your local ER or call 911.
Hello everyone, this is Carrie Schlenker. I'm the Benefits Advisor for North Alabama. Today we're going to go over the Flexible Benefits Plan. The first benefit we're going to go over is the Healthcare Reimbursement Account. This account has been around for over 40 years. It was set up by the federal government to allow us to pull money out of our paychecks pre-tax for medical, dental, and vision expenses. We never pay tax on the money that we put into this account. This is an awesome benefit. I've had folks that tell me, look, I can't afford to have any more taken out of my paycheck. No, you can't not afford to do this one. If you're making it paycheck to paycheck, that's great. If you're making it paycheck to almost paycheck, then you need this account. This account allows you to pull money out of your paycheck pre-tax for medical, dental, and vision expenses, doctor copays, pharmacy copays, hospital deductibles, glasses, contacts, eye exams, dental expenses up and above the insurance, braces for yourself, braces for your child. You can use this money for you, your spouse, your dependent children, even if they're not on your insurance. This is an awesome benefit. As state employees, we have great benefits. You just have to bring this knowledge to the employees for them to make use of. Now, okay, the minimum you can contribute to this account is $120 for the year. Divide that by 24. You sign up in November, but the account's going to start in January. We have 24 paychecks throughout the course of the year. So if you did the minimum, 120, divide that by 24, That's $5 a paycheck. $5 pre-tax. Okay, now the maximum you can do is $2,750. This maximum is set up by the IRS each year, so this amount can change. But for now, $2,750. Whatever amount you select between the $120 or the $2,750, you can go ahead, divide that by 24, since we have 24 paychecks, and that money will come a little bit out of each paycheck. But the nice thing about this account, you have a debit card associated with the account that you'll have before the first of the year. That debit card is pre-loaded, okay? All the money that you've obligated in November's open enrollment is put into that account at the first of the year. Plus, the state gives us a $50 bonus every year. Free money. Why not? Okay? So even if you did just the minimum, $120, you're going to actually start your account with $170. You've got that debit card. You go to the doctor, you go to the pharmacy, go to the hospital, get glasses, contacts, eye exams, go to your dentist, orthodontist, present that card. They can swipe the card. The money comes directly out of that account and pays that provider. You've got an interest-free loan because it was given to you up front. You're paying it back with tax-free dollars. You're keeping Uncle Sam out of your pocket. Plus, the state gives you $50 free cash. Even if you did $120 for the year and try this account, you're getting $50. You can't put $120 in a bank and get a $50 bonus. This is a no-brainer. Y'all, this works. Like I said, I'm in this every year. At the end of the year, if you've got money left over, as long as you create an account for the next year, remember, November, that's open enrollment. So in November, you create an account for the next year. Any balance for this year, any balance will roll over into next year's account. But you have to create an account for the next year for it to roll to. Now, this amount changes, depends on the IRS again. They'll tell us how much can roll over, so you need to check with your advisor. Towards the end of the year, start looking at how much money you want to put into your flex account, okay? And that's what everybody calls this, the healthcare reimbursement account. That's a flexible spending account. So when folks call me and they have a question about their flex account, I automatically go here. I know that's what they're talking about. Have you ever had that quiet person in the office that doesn't talk about much of anything? They're real off by themselves. That's the person, if you go to in your office and you say, can you tell me about the flex account? They will come unglued to tell you about the flex account, y'all. This works, okay? So this benefit, I highly recommend for everyone. If you've got that money on the card and you need to go to the doctor, if you need to take the baby to the doctor, if your spouse needs to go to the doctor, remember, you can spend it on you, your spouse, your dependent children, even if they're not on your insurance. You've got that card. If you need to go to the doctor or pick up a medicine, take that card. Go. The money is on the card at the start of the year. It does not matter what you've got in your bank account or in your pocket. You've got the money to be taken care of with your doctor, your hospital, whatever you need. This account works. This is an example of some of the savings, how it works. Because what it comes down to is you're not paying tax on that money. You have kept Uncle Sam out of your pocket. But remember, on top of this savings, you've got a $50 bonus the state gives you every year. Plus, you got an interest-free loan because the money was given to you all at the start of the year on your debit card. Dependent care reimbursement account. Now, this one's different. It does not have a card. There's no debit card associated with this account. This is for child care, adult daycare. So daycare, after school, summer daycare, things like that, but it can also be used for adult daycare. Okay. Now, the minimum with this account is $120 again for the year. Remember, we've got 24 paychecks. Whatever amount you use or you decide you want, divide it by 24. Now, the maximum contribution, $5,000. Now, remember, whatever you contribute to this account, it's pulled pre-tax. You're keeping Uncle Sam out of your pocket. Now, whatever you put into this account, you can't claim it on income tax at the end of the year because it's never been taxed. You're keeping the money that normally you would get back at the end of the year from Uncle Sam. You're keeping it in your pocket during the course of the year. So if you do this account anywhere from $120 minimum up to $5,000, remember it's dividing between the 24 paychecks again. The account starts at the first of the year. This account, as well as the healthcare reimbursement account, are managed by a company called Optum Financial. They bought out Connect Your Care, who used to do this account for us as of July 1st this year. But nothing has changed. Still got a fantastic website app you can use to manage this account. You can get in touch with them 24 hours a day. Still an awesome benefit. But on this benefit here, like I said, you can do anywhere from $120 for the year up to $5,000. No card. Remember this. I've had folks that think that both accounts are tied to that debit card. No card is associated with the dependent care. What you have to do, you can actually go to the Optum Financial website or to their app and set up direct deposit. You have to pay your daycare expenses and submit those itemized receipts to Optum Financial. Now you can do it online with a scanned document, or you can do it with their app and just take a picture of the receipt. So easy. But you submit those receipts and then the account will reimburse you back, either as direct deposit or a check coming in the mail. Now, the carryover provision for this account, the IRS sets up the rules for that each year. I always tell everyone, just count what you need for the year. Anything up and above what you put in this account can still be claimed on your income tax at the end of the year. This is an example of the savings. Again, what it is, it's coming out pre-tax. This is the money, the savings is the money that you would normally get at the end of the year from Uncle Sam. You're keeping this in your pocket. This works. Okay, so you've got an interest-free loan. Again, all the money was put into your account at Optum Financial at the start of the year. There's no debit card, but you can get reimbursed by just submitting your receipts, and that money comes back to you. Just remember, with the HCRA, Healthcare Reimbursement Account, you can either have a check reimbursed back to you, or you can do direct deposit. That's what I have. I've gone in and set up, you have to have your bank account and your routing number, and you can go in there and set up direct deposit. You can use the app. You can use their website. Awesome, so easy. And like I said, I use the app all the time. And you have access to the Flex card, which is a debit card. All the money's put into that account at the start of the year. Whatever amount you obligated, you've got an interest-free loan. You're paying it back with tax-free dollars, and you got a $50 bonus. No brainer, y'all. It really works. I've had folks that try this account for the $120 and they get the $50 bonus. The next year, they can't wait to up it because they realize how beneficial it was for purchasing their medicines and things like that. Now, remember, on the dependent care reimbursement account, this is either check or direct deposit. There is no debit card, okay? The money is all deposited into your account at Optum Financial at the start of the year, whatever amount you obligated. No bonus, but you have access to that money. You can pay your daycare expenses, submit the receipts, and get this money back. Y'all, this is an awesome way to keep more money in your pocket during the course of the year. Well, everyone, have I said awesome enough? This is a fantastic benefit. I love sharing information about it, and it helps. If you've got questions on this or any of our benefits, please contact your benefits advisor. Thank you, and y'all have a fantastic day.
Hey y'all, I'm Jeannie Blake with the State Employees Insurance Board Benefits Advisor, and we are going to get started today talking about health insurance in retirement. SEEB health coverage in retirement. Who is eligible for SEEB coverage in retirement? Of course, you must receive a monthly retirement benefit check from the RSA. Tier 1 is 25 years of service or 10 years of service at age 60. Tier 2 is 10 years of service at age 62, and then disability retirement with 10 years of service. You must have 10 years of credible coverage with SEIB or PHIP. Now, notice in red, years of service does not equal years of credible coverage. We're going to dive into that just shortly. What SEIB coverage is available in retirement? Health insurance plans, including some free plan options, plus standalone coverage. Health coverage options in retirement. You are eligible for the State Employees Health Insurance Plan, also called CHIP, our Medicare Advantage Plan, the Supplemental Plan, the Optional Plan, and the Retiree-Only HRA. Benefit changes at retirement. Health insurance premiums will vary. They are subject to the retiree sliding scale. We're going to get to that just shortly. Medicare requirement. Now, Medicare eligible members and covered dependents on a retired contract must enroll in Parts A and B of Medicare. So in order to have our Medicare Advantage plan, you must have your Part A and Part B of traditional Medicare upon your retirement date. Members who are already Medicare eligible must be enrolled in Medicare Part A and B and have effective coverage on their retirement date. If you fail to enroll in Medicare Part A and B, you will automatically cancel SEIB health coverage at retirement or at the time of Medicare eligibility for early retirees. Federal law allows enrollment in only one Medicare Advantage plan and one Medicare Part D plan. Enrolling in another Medicare Advantage plan or an independent Part D plan will automatically cancel your coverage through SEIB. Retirees can only re-enroll in SEIB's Medicare Advantage and Part D plans during open enrollment if the coverage was canceled. Discounts. Retirees and covered spouses on the Medicare Advantage plan do not have wellness or gap in care requirements. The supplemental plan is free to our non-Medicare retirees and their non-Medicare dependents with other group health insurance covered through a spouse or another employer. The premium cash option is available to active employees only. The flex benefits plan is also available to active employees only. The retiree-only HRA allows you to spend down balance in premium cash option or the limited purpose HRA in retirement. Of course, just another note, SEIB members are eligible to enroll in only one health insurance plan. You must have other group health insurance that is not provided by SEIB to qualify for any of these free plans. Post-retirement employment. If you get another job after retirement, you must take your employer's insurance if the employer contributes 50% or more towards the health insurance premium for single coverage. Spouses must have Medicare Part A and B regardless of their employment status if they are Medicare eligible and on your retired employee contract. If this is going to be you and you are going to seek other employment after retirement, make sure to call your SEIB advisors, call one of us, so you can get more information on the free plans that are available to you and your eligible dependents. All right, so now the fun part, determining your premium. The retiree sliding scale. Employees retired on or after January 1, 2012, the premium based on years of credible coverage in the CHIP. Employees retired on or after January 1, 2012 without Medicare, your premium is based on years of credible coverage in the CHIP and your age at retirement. All right, so the retiree sliding scale years component. Like we mentioned earlier, years of service does not equal years of credible coverage. Your insurance is calculated on years of credible coverage, whereas your retirement is calculated on years of service. So just an example, an employee who works or has worked for a local government entity that participates in the ERS system may not be able to use those years of service to credit towards your SEIB premium. All right, so there is a 4% increase every year under 25 years of credible coverage in the years component. There is a 2% decrease for every year over 25 years of credible coverage in your insurance premium. All right, age component. Your age, not your age at retirement. So your premium will be calculated on your age at retirement until you are Medicare eligible. So your age impact, it does not lessen as you advance in age. For example, two state employees ages 60 and 62 retire with 25 years of credible coverage with the same coverage. The 60-year-old will pay 2% more than the 62-year-old for the same coverage until they reach Medicare eligibility. So as you can see, the age component continued. There's a 1% increase for every year that you are younger than age 65 at retirement. Medicare eliminates the age component of the retiree sliding scale. C, which is us, we must be notified if a member and or their covered dependent becomes Medicare eligible prior to age 65. Some reasons for early eligibility are disability and then end-stage renal disease. Okay, this is one of my favorite things that I like to tell all of my members about. You can calculate your retiree premium on our website. It's very, very easy. It's the same system that we use, but you can do it yourself. So if you're having a bad day at work and you say, let's just see how much my retiree premium is going to cost me, feel free. You can do it as many times as you want a day, as many times as you want per month. You can find it on our website at www.alseib.org. All right, moving on to continuing coverage after your death. This is not something fun that we want to talk about, but it is something that we must cover. It's very important. Surviving spouse coverage is available if the spouse is covered as a dependent at the time of death. If the surviving spouse declines continuation of SEIB coverage, they will not be eligible to return to SEIB coverage at a later date. Please talk to your spouse about this. Y'all go ahead and have a plan because this can happen and you don't want to be without insurance coverage. The base rates are just some examples below. Non-Medicare surviving spouse rates, these are base rates before any discounts. Single coverage is $502 per month. Family coverage is $759 of non-Medicare and $668 for Medicare. Our Medicare surviving spouse premiums, again, these are base rates before any discounts. Single coverage runs you $271 per month. Family runs $528 non-Medicare and $437 Medicare.
We have reached the end of our presentation for today. We have a few important dates. Open enrollment is November 1st through November 30th. This is when you can make plan changes, status changes, flexible benefits and enrollment and re-enrollment. We have a wellness discount deadline, which is October 31st. New enrollees have 90 days after enrollment. We have a gap in care premium discount deadline, if identified, and it is October 31st. Our contact information: by mail, P.O. Box 304 900, Montgomery, Alabama 36130. Or you can go online to our website, which is www.alseb.org. Or you can reach us by phone, 334-263-8300, or toll free at 1-866-836-9737. Here's a picture of our SEB Advisors map. You can look at the map to find the advisor in your area, or visit our website at www.alseb.org to determine your agency's designated advisor. Thank you for attending.